All right, good morning, good afternoon, good evening, good whatever time it is, wherever you are. Welcome to this conversation, Why Health? My name is Amani Maranga. I'm going to be your moderator, really, and I am so honored and privileged to be with this beautiful, intelligent, well-spoken ladies, and here to talk about public health, but also to talk about their journeys, their careers, talk about how they've gotten to where they are. And what we hope to be able to do today is inspire you, is to be able to tell you good stories about growth, about learning, about impact, and that you can really do anything that you set out to achieve anywhere in the world. And those are the words of Dr. Caroline Kingori, whom I'll be introducing last. So let me tell you, I had the honor of reading this profiles of these wonderful ladies that you see today. And I am so blown away. I don't even know how to introduce them. So let's just say they're very intelligent. Let's say they've had a lot of impact. I'm going to try and do them justice, but we have the top cream of public health professionals that I've ever met. And no, I've met many, but this is like the top. So I'm going to start with Dr. Ngaruya. Hi, Dr. Ngaruya, please wave, let everybody see you. She's an assistant professor in the Department of Emergency Medicine at Yale University. Now, for those of you that are from the Camba and Mexico, it's Yale with a Y, okay? So that's what we mean. It's not jail. It's not Yale University. It's Yale University. And she has done a lot of research on non-communicable diseases, barriers to care, community-based interventions with a particular focus in Africa. And her work has focused on health disparities amongst the minority populations in the US, community-based and community-based participatory research. She's highly awarded and highly honored. I cannot read all these awards. I mean, it's going to take half this webinar, and we don't want to do that. But let me tell you this: she's passionate about emergency medicine, and we are very privileged to have her. Ladies and gentlemen, please welcome Dr. Ngaruya. Karibu tafadhali.
Asante.
The next person I'm going to introduce is also highly decorated. Her name is Dr. Elizabeth Wachira, and she says that her purpose is community outreach. Her commitment as a director of public health programs at the A&M Commerce, she wants to achieve health equity for the marginalized and underprivileged. Her work starts at the grassroots level by empowering communities to unite together for one common goal. She's worked a lot with the youth, and she says that she wants to be able to give a space to inform, inspire, and innovate future public health leaders. And so she empowers others so that they can do the same. Ladies and gentlemen, please welcome Dr. Wachira.
Hello. Asante.
Last but definitely not least, our convener, my friend, Dr. Kingori. She's a faculty member at the Department of Social and Public Health at Ohio University. And those of us that are in this part of the world, it's what we usually call Ohio. Okay, that one. Her work is a lot around sexual health, HIV and AIDS, and having the intersection between non-communicable diseases, especially diabetes and HIV. She has, her current project is a selected markers of development of diabetes among HIV positive individuals. She has worked in Ghana. She has worked in research in Kenya, in Tanzania, in Botswana. Was it Botswana? Right? And of course in the US. And she's passionate about sexual health, sexually transmitted diseases, cervical cancer, mental health, and especially among people of African descent, immigrants, refugees, college students, and other disenfranchised communities. Ladies and gentlemen, give it up for this powerful woman, Dr. Kingori. Thank you, ladies. Really, it's a mouthful, and I've tried because you've done so well for yourselves. And let me first say, on behalf of the Kenyan community here in Kenya and the Kenyan community abroad, you have done us proud. Well done. Well done. We're very proud of you.
Thank you.
So let me start this conversation off with a bit of your personal stories before we get to work, to the work that you've done. And, I was having a conversation with Dr. Kingori, and we're talking about just, where do we start this conversation? And she said something really interesting. Most of us are told, ask the question, what do you want to become when you grow up? And she says it's such a cliche question because we don't know what we want to be when we grow up. And we all become different things over time. So the question I want to ask you is, what did you want to be when you grow up? Is this what you wanted to do? Let me start with you, Dr. Ngaria.
Sure. 1 minute. Oh, okay. I'm unmuted. So thanks again, Amani, for that kind introduction. Thanks to Dr. Kingori for organizing this. And it's really a pleasure to be here today with all of you. So funny enough, I actually always knew I wanted to be a doctor. Coming from a traditional Kenyan family where the three options for a successful job were physician, lawyer, accountant, and maybe engineer. Physician was presented early in the home at that time, but I actually enjoyed the sciences and I knew I wanted to be in a profession that was helping people. And so I kind of stayed on that trajectory. And again, true to self, it was something that fulfilled me, and that's what I ended up in. I, along the way, had other interests, and as we know today, and many of us mentor today, there are so many other really excellent options and fantastic ways to be in the world, including in the arts. And for example, for me, for my undergrad degree, I actually did sociology and psychology, although I was pre-med at the time, but that really enriched my purpose and enabled me to learn about public health, for example, through my sociology degree, systematic disparities in care and access to care. And so it's really important to have this diverse exposure to a variety of activities and educational opportunities, even if you're supposedly focused on one particular thing. And so I actually dabble in a variety of other areas outside of that because of my diverse interests, but truly I started off as wanting to be a doctor, and that's where I ended up today.
Oh, wow. That's really cool. Dr. Wachira, tell me, is that your story as well? Did you always want to be a doctor?
A little bit different. So I remember saying I wanted to be a mathematician for just a few years, because okay. I actually thought my dad was a mathematician, but he wasn't, because I assumed I was the smartest person in the room. And I liked math. And when I learned about math, it was very enlightening. But as I got older, I wanted to be a doctor, and I had a very sickly background, being from malaria, cerebral malaria. Actually, I was born with rickets. So I spent a lot of time in the hospital for a long time, up until maybe the age of 7, 8. And that really shaped my desire to help people. I had my primary doctor, who was also called Dr. Wachira, actually really walked the walk with my parents and my mom, in terms of how to fix rickets. They had one doctor say, well, you have to do surgery, straighten the legs. And my dad was like, we are not doing that barbaric thing. But Dr. Wachira came into the scene and really educated my parents on what rickets was, how to handle certain things, how to make sure that my malaria doesn't get to a point where I'm having seizures, for example. So seeing that education and relationship between daughter and myself and the doctor, it really put the desire to help people. So the only definition I had was being a doctor. And for a long time, that is what happened. But as Dr. Christine said, in my master's and PhD, I took anthropology, medical anthropology and medical geography, which even though I was, for my bachelor's, I was nursing, and then I wanted to do medicine afterwards. But during that time, I learned about public health because I wanted to apply to an osteopathic school of medicine, which there's only one in Texas, and it had a school of public health. And the more I read about public health, the more I said, this is my heart. I want to help people, but I got another definition, and anthropology also allowed me to really get into the idea of structural violence and how to tackle inequities more systematically as well.
Oh, wow, that's such a deep story. We'll get back to that, but it's very interesting how these childhood experiences sort of shape who we become. Dr. Kingori, what's your story? I'm sure you wanted to be a musician, right?
You know, because you know me quite well. I did want to sing it, and I sang in a choir. So
Yes.
that was definitely something. I didn't want to be a musician per se, but I wanted to be a designer after high school.
Oh, wow.
Right. I've always liked fashion, so I still like it. I thought, hey, I can be a designer. And then, like Dr. Ngaroya said, our parents are like, what are you going to eat with that? You know. So I said, okay, let me find something else to do. I said, oh, I think I'll be a psychologist. And the same question came up again. And I was asked, but how are you going to feed yourself with psychology? And so I shelved that idea. And I went after high school, I did computers, you know, because, you know, we had to do computers and learn. And then I did French. Ask me why. I just liked French. So I did French for a year. Right. I can't even speak it now. Did it for 1 year, still figuring out. And then my dad was like, why don't you just go do, because you're good in business and economics and accounting, why don't you just go do some business course? I mean, for sure that is going to give you some money for your career. I said, sounds good. So I did banking and finance. The first couple of years were fine, you know, looking for jobs. And then I was just like, I still want to go back to working with people, you know. And at the time is when I started feeling the need to be a psychologist. I was always talking to people, you know, being at the Nairobi Pentecostal Church for some reason. I was always a group leader. I'm always listening to people's issues and trying to solve problems, etc., or advise people. And I thought this is a good plan. Then again, it was, there's no money in that. And I was like, I can't do banking anymore, you know, and I quit. And I stayed home and everybody thought I was nuts, you know. And I said, I'm not doing anything else until someone helps me figure out how to do psychology. So my mom was like, just go to the parallel program. This is a university part-time program. And I actually applied and I did get accepted. And then at the same time, I applied to come to the US. And you know, because I had done banking, the plan was, you know, do something consistent so that when you go to the embassy, you won't be asked too many questions, blah, blah. And so I had to apply for an international business admin degree. And I was just like, I don't want to do this. And my uncle here in the US said, just get here. You will do whatever you want to do once you're here. So I did the IBA for 1 semester. And then I transferred and I started on my psychology and I was so excited. I was like, whatever, I'll eat air if I have to. I transferred to another 4-year university on full scholarship. And then I met some faculty members, and this was at Morgan State University, and it's called a historically Black institution. So just being there and the nurturing and the support I received, and you know, seeing people who look like me, and you know, they were always reminding us you have to work extra hard to make it. So I continued with psychology the first couple of years, and then I met a program called Prevention Science, and that was public health. And I was like, oh, this is it. This is what I have been looking for my whole life. I would have done industrial and organizational psychology, which by now would have been extremely rich. My dad would have been happy. No, just kidding. But it was about the passion. The passion is what makes you wake up in the morning. And I knew I wanted to work with people and not just the one-on-one, working with communities. We had done that in Kenya. And so that's how my journey into public health started. And I did a Master of Public Health and then the PhD in health behavior. So I'm still studying behavior. You know, I'm still studying why people make the decisions they make in terms of their behaviors. But this is just now more on a population level. And I love what I do. I wake up in the morning smiling. It gives me a lot of creativity. A bunch of things have come up, which we'll talk about as we go along. But just the interaction with people, it keeps me alive. I like listening to people's stories. Again, I'm still doing that. And I'm figuring out what makes them tick, what makes them make the decisions they're making, why are they eating what they eat, etc.
Wow. It's so cool what I'm hearing, because I'm hearing three different paths that have led to where we are today. One that it was very direct. This is what I want to be a doctor, and you sort of work towards there. This is the other is, these are my experiences. This is what I've gone through, and I want to help people. And then, well, CK, I don't know where to categorize yours, Dr. Kingori. Yours is, where does this train go? Let's find, and I really like that, because I think one of the things we can take out from this conversation is that there's not one path to where you're meant to be. We all take different paths, and what you need to be is true to your journey.
Right.
And I'm hearing that from you three. Allow me to ask a direct question to Dr. Wachira, because your story is from your experience, and I want to ask this question, and any of you can jump in if you have something to add. So how do you feel that your childhood experience has shaped what you do today? I mean, it definitely shaped the path in terms of wanting to help people, but in terms of how you execute what you do today, how has that childhood experience shaped you?
That's a great question, and have actually never thought of it that way, but I think when teaching it, I'll answer it based on how I teach my students. I always tell them, put yourself in the place of the person you want to help. Put your person in the shoes of that individual. And I'm really big on understanding the lived experience, because it's in those getting to walk that person's road, you get to see some of the challenges that they may be facing that actually are important for you to tackle as a professional. So I think it's the empathy, right? Knowing that having a qualified health professional that not only gave me necessarily medicine, but they also focused on the humanity aspect of me as a patient, not a number, but a person who is shaped by the beliefs of their parents, by the culture, norms. So in order for him to really, I believe, help my parents and meet them where they were, it took time to get to know that person. And so for me, in my interactions, whether personally or professionally, I always come from the point of what is that person's authentic story? Where are they? And I put myself in that situation. And that helps me in terms of be a better educator, in terms of be a better mentor, and also a mentee as well.
Wow, thank you for sharing that. Dr. Ngaria, from your garb, it looks like you're practicing. Is that true?
Yes, I am. Yes.
And so I want to ask you the same question, but just with a little twist, because you come from here, you come from Africa, you come from Kenya, and you're now practicing in the US. Is there anything that you carry from your experience here, from your upbringing here, that goes into your practice?
Right. So interestingly enough, I actually had a similar story that to Dr. Wachira's in terms of thinking about medicine. So when I was a child growing up in Kenya, I actually had a lot of allergy issues, and I had a lot of recurrent ear infections, and similarly had a very close relationship with my physician, who was an ENT, Dr. Mashari. I still remember his name, right? And I was like 6, 7, 8 years old. And I actually always thought I was going to be an ENT. Of course, I didn't become an ENT. But certainly being exposed to health issues as a child, I would say the second bit is growing up in Kenya and being exposed to, but not truly understanding until I was an adult, the impact of barriers in access to care and understanding the role of poverty in health. Obviously, I didn't learn this until I actually came to the US and started studying it in university. And the same issues are in the US. There are individuals who are poor. There are differences based on people's race in terms of levels of health outcomes. And so that's where my work was primarily in undergrad and medical school. But I always knew I wanted to come home and do work there. And that's where my work has continued to be, working with marginalized populations or underserved or under-resourced populations, because of that understanding that poverty is a real factor, but we actually can do things to make a change about it. And I guess I would say the last piece about that was a bit more personal. So I think, like I shared with you guys, I was born in the US, but I left where family left when I was very little. So I was about 6 years old. And I still remember to this day also moving there as a kid and really having a hard time making friends and being bullied because I had a funny accent, or, you know, I would say airplane. I remember this one kid in my class, I said, there's an airplane. And he said, airplane? And it was air. He was pointing at the air, and I was like, oh, that's good. But the point is, I think that upbringing of sort of always being a little bit different, you know, when I was growing up there, it was like, yeah, you're Kenyan, but you're not really Kenyan enough. And then coming here, and it's like, you're American, maybe, but you're not really American enough, has really sensitized me, I think, to just being a, you know, team player for the outsiders, quote unquote, for marginalized populations, people who don't quite fit, people who don't have a voice for themselves. And really that's kind of the common thread throughout all of my work. As you mentioned, Amani, I previously worked primarily with underserved populations in the US, that was particularly women. And then I worked with refugees also. And then now again, I moved on my work about 10 years ago, just solely to work in Kenya and under-resourced populations there. And I'll stop there.
Thank you for sharing that. That's pretty cool, and such good personal stories. CK, I have a question for you, and I want to start. Sorry, Dr. Kingori. So Dr. Kingori and I are old friends, and so I'm really trying to switch to the formal, title here. Dr. Kingori, you also have had experience working with, underprivileged and underserved people, and you've done research in all these different African countries, and I guess that has exposed you a lot, especially when it comes to HIV and AIDS, and I'm sure it comes with a whole different way of looking at life. What has that done for you in your career today?
That's a really good question, Amani. And what it has done for me is, first of all, learn the importance of empathy, and which is why I like listening to people's stories. Like Dr. Ashira said, it's important to always know where someone is coming from, to understand the background, to understand what influences their behavior. If you've watched the news and you've seen how Africa continues to be painted as this dark continent, and it's not just Africa, but other places, but let me speak about Africa right now. I wanted to tell a different story, okay? I wanted people to see the light in Africa, which is why I wanted to go to different countries and not just in Kenya, because I wanted to know what else is going on in these other countries. And where HIV is concerned, there was always this undertone that Africans are not doing enough to protect themselves. I teach a course in HIV and sexually transmitted infections, and I show them the history of HIV and how it started and in the different continents. And, we talk about how people who have HIV are looked down upon. And when you think about countries in Africa, you look at the poverty, which is also intertwined with this infection. And you look at other social and contextual issues. So all that work placed me in a place where I wanted to just tell a different story, and let people know that it's not the fault of Africa. They're not having sex with multiple partners, because that has been a story. They're having too much sex. What? That doesn't make sense at all, and with that connotation, it was always the issue of saying that polygamy is a driver of STIs and HIV. But then I said, here in the United States, we still have high rates of HIV and other sexually transmitted infections. And now we have new names and meanings to the groupings. There's a throuple, people who are in relationship with 3 people, with 4 people. It's the same thing. We call that in Africa with polygamy. And we all have our own ideas about polygamy, but it's an institution. And so if we are coming to this context, we have to understand what is it that they do? How do they understand their behaviors and the impact of the context and their behaviors and how that influences, the health issues that they have, but we cannot speak for them. Okay, so yeah.
I really like that the three of you in different ways have spoken about empathy. And first, let me tell our listeners or our viewers, please check out Dr. Kingori's work about stigma and how stigma is not blanket, it's cultural and in different contexts. And I found that very interesting when I was looking you up. Yes, I did look you up. And I was looking you up and seeing the work that you're doing, and I found that very interesting that the different contexts and different cultures, ethnic profiles, but also what living standards and things like that, they actually affect how stigma is applied in those different contexts. So please check that out. I found that very interesting. I want to move into your work a little bit, if you'll allow me, ladies. And I want to talk about the work that you have done back in Kenya and the work that you have done in other parts of Africa. And the question I want to ask from an empathy lens is, what would you like to see? So, and let me create some context for this question. I know you're doing research, I know you're doing work, you're helping people, but I'm sure there are things that if you had the pen that made the difference in terms of policy, or that made a difference in terms of how treatment was applied or how perspective was given to a certain issue, what would you change from it? I want to go beyond the impact you've had to what should we be doing? Let me start with you, Dr. Washira.
I was really hoping you would call me last, but it's okay. That is a great and a deep question, but I love it. I think for me, the work that I typically do in Kenya is actually hands-on youth engagement. I have a passion for young people. I'm here in Texas as a youth pastor. I teach young people. So young people are life, they're it. So my brother and I have an organization called the Youth Engagement Society. And it's really a mentorship program where the idea is that you can only dream as far as you can see your reality. And Christine has alluded to poverty and other barriers that really pull us down from realizing our greatest potential. And when I think about myself, I'm not special or unique to that. The only difference between me and a young person in Kenya today is that my parents were able to come to this country. We were able to be here, and the education that I received was not contingent on how much money my parents could pay the professor. So corruption, the idea that there are a lot of great and smarter young people than I am that are more qualified, but because of the challenges and the ideal of competition between the haves and the have-nots, they're limited. So the work that we do is to really bring resources to whosoever will, right? To create a buffet table in terms of connecting mentors and mentees together, allowing young people to think about how they can do work in the context that they're in. So rather than bring, for example, only the Westerners to Kenya, we are challenging the idea that it's Kenya for Kenya, it's Africa for Africa. We have the talent, we have the brain capacity, we have the resources aside from these structural barriers, but it's only us coming together to tackle those, to tackle corruption, to tackle these norms about who should be rich, who should be in this place of power. So it's bringing the resources that we're able to, which is our capacity. The ideas that we have learned, the things that I have learned in this country, the experiences that others in Kenya share, and creating spaces of empowerment where we inspire, where we engage, and we connect Kenyans with Kenyans. We connect young people that, for example, are tackling mental health in Garissa, or they're tackling FGM in a community. We link them up with organizations and people in that place that are tackling that. For example, we have young people that are wanting to tackle crime. So we connect them with Pete at Crime CPOA because he does have the capacity, right? And he wants to mentor, but that individual may never reach Pete, but we can. So we create a pathway of connection and then step aside and celebrate.
Oh, wow, that's really cool. And thank you for the work that you do. And it's interesting because you focus on young people, and this is a continent that's 70% young. It's a continent that's 70% under 35, and in fact, and that under 35 is really an exaggeration in age. Most of these guys are 25 and under.
Yeah.
And so that's a great focus. Dr. Kingori, you come here very often. I know you were starting something with was it Kenyatta University that you were starting something with, and I just want to know what impact, not just impact you'd like to see, but what would you change? What would you change if you could?
So piggybacking on what Dr. Wachira has said, I also have a passion for young people. And I think it's from our own growing up, in the fact that often young people are ignored. People think the young people don't have a lot to bring to the table. But as you can see, there are a lot of inventions in Kenya, there are inventions in Africa. There's a lot of creativity. And so I would want more investment into young people's dreams. If they start out like me, like you said, they get on a train and they see, where is this train going to go? Someone did listen, and someone invested, and eventually I knew what I wanted, I got there. I found what I needed. But the other thing that I'm passionate about is the topic of reproductive and sexual health that is so hush-hush. If you saw in the news recently, COVID-19 has had its share of misery and issues. And we have a lot of young people in Kenya who presented with pregnancies, right? What they call unplanned pregnancies. And so there was all this hoopla, what are we going to do? What are we going to do? And then recently the president said that any clinic that's offering these young people contraceptives, they're going to be shut down. I was like, what are we doing again? They're getting pregnant. We know that contraceptives work, but there's always a notion that contraceptives lead to promiscuity, and that's not the case. We have enough research to show that abstinence only doesn't work. You have to combine abstinence, condom use, counseling. And so my thing, what I would want to see is those people who are impregnating these young people, why are we not, trying to figure out who they are instead of punishing these young people? A while back in Tanzania, those young people who were pregnant, they were barred from going back to school. I mean, we're talking about trying to reduce poverty. How are we going to reduce poverty when we can't give people the basic, a basic need like having education? And so I would want these policies to change. I would want us to be more open-minded, and not to look at young people like they're a pain in the butt, like they're a nuisance. We were all young. All these people were young. All these decision makers were young. They made a lot of mistakes. And so we need to invest in the young generation, 70% of them. We need to figure out a way to make them more involved again in matters of leading the nation and improving their lifestyles.
Oh, wow, thanks. And thanks for talking about that, because it's one of the things I've been thinking about, because I work with men generally here. And, I was trying to figure out, is this burst in pregnancy, is it younger men? Is it school kids? Because they're all at home and we can't put that past them. And what do we do in terms of education in that space? And then obviously there is a chance that there's older guys, getting involved with these young ladies. And how do we empower these young ladies to make the right decisions for themselves as well, and stop these men as well from preying on younger women? And so this is a conversation that's ongoing in my mind, and thank you for bringing that up, because there's where we can go in terms of public health policy, and where we can go in terms of behavior and behavioral change. Dr. Ngaruya, obviously, thank you for unmuting yourself, because you knew I was coming to you. I want to hear about the work that you're doing and what you would like to see change.
Sure. So 2 things. One is complementary to what Dr. Kingori said. And we've actually spoken about this. So while her work primarily focuses on HIV, which is a communicable disease, meaning a disease you can transmit from one person to the other, my main area of research, and I see she's smiling, is on non-communicable diseases, which are diseases that you can't necessarily transmit from person to person, but are contributing to what's called the double burden of disease, particularly in low and middle income countries. They're now the lead killer and have overtaken that secondary to HIV, TB, and malaria that have been preached and preached and preached in our countries. And so really that's been my mission and my focus for the last 7 years. I was really fortunate to work with the Ministry of Health to help lead the first ever national study on NCDs in Kenya a couple of years ago. And we published 10 papers out of that work, making Kenya, honestly, the WHO member state to have this caliber of work out of that study tool that the WHO has recommended. And it was really eye-opening. And that kind of leads to my second point with regards to research and a culture of academics in our country, because someone should be able in Kenya to be like one of us, i.e. and have a legitimate income and thrive in that, which you can do in the US and many other countries that have that appreciation for the academic focus. And the reason for that is that, just because a study has been done in the West, like in a US population, it doesn't mean that the findings are necessarily going to be similar for a Kenya-based population or an African population. So many of the guidelines that we have, for example, let me give us just a very unique but common example for heart disease. These are based on probably a study called the Framingham Heart Study that was done in the US in the 50s, 60s. But again, this was done solely on a US-based population, and we're using our treatments based on this population that may have nothing to do, and we're seeing that now in studies that are being done on NCDs in our settings, but very few still. And it's the case that it's not necessarily transferable. And so that's really my two areas of focus. And I wanted to speak a little bit about kind of the research academia focus. I mean, for me personally, I do come to Kenya 3 or 4 times a year at the peak of the last 7 years. And I mentor on average 10 trainees at any given time. Many of them, it's again, like I think Dr. Kingori, Dr. Kingori said, it's a bidirectional relationship. So one who was a medical officer at Kenyatta, I wrote her a letter. She's doing emergency medicine specialist training in Tanzania, doing really well. She was with me at Yale for some time last year. All of my mentees have presented at national and international conferences, many for whom this was their first time. One came to APHA, the American Public Health Association, and he did an oral presentation. To get an oral presentation at APHA is no small feat. And he came, and that was his first conference as well. And then to sort of capitulate on that, I launched an organization called Kenyan Doctors USA. And I launched that last year. And this was an organization to bring together individuals of Kenyan descent who happen to be based in the US for whatever reason, but who, like me, are really passionate about connecting back home and doing meaningful work around clinical research and teaching, and coming alongside organizations in Kenya in healthcare to collaborate with them and uplift any work that they're doing. And so we launched that organization. It's a web-based organization, Kenyan Doctors USA, or KEDU. We launched that last November. Our active programming started in April. We have a mentorship program that has already 200 people signed up. We have monthly webinars, which have capped at 300 people at a time, 60-40 split, depending on the nature of the talk, 60% US, 40% Kenyan. Sometimes it goes the other way. And we've been doing that. I'm really passionate about that as well. And then the last bit, my family, we were super excited to launch a new fund at the University of Nebraska, where I went to undergrad and med school. It's called the Ngoria Family Fund, just to honor my parents, but also to honor all of our awesome mentors. We've all talked about mentors. And it's a $2,500 scholarship for research, specifically for people of international background. And I specifically highlighted, obviously, women and people from the African continent, but specifically for those of international background, to give those like ourselves, myself and my sister, an opportunity at the University of Nebraska to also advance in their careers.
Oh, wow. Wow. I'm mind blown, by the work that you're doing. And so let me just first, again, just congratulate you. What you're doing is important work. What you're doing is meaningful work. And we're fortunate to have you at such a time as this, doing the work that you're doing, both in the US and here back at home, and in Africa as a whole. And so thank you for doing that, and we really, really congratulate you. I have a question for you because, pardon?
Let me say the cherry on that cake is Dr. Murray and I are going to be working together very closely very soon. We're already planning a grant to bring together the communicable and the non-communicable diseases.
Nice.
Oh, wow. Good stuff.
Yeah.
Good stuff. I want to talk to you about just public health in general, and not necessarily in your different fields of expertise. COVID-19 has, sort of brought a bit more awareness into our public health systems, and especially here back at home, our preparedness for a pandemic, our level of education, our public education in terms of the pandemic, level of expertise in the hospitals and in the public healthcare system, PPEs, whatever you need to manage that system in terms of medication, just all these different things that are part of the public health system have been brought to some sort of highlight. And we seem to be failing. Because I don't know, but seem to be failing. There's some level of great management that's happening. Our numbers have been rising, and I guess expectedly they've been rising, and they're going to rise the more you do testing. But I don't know if our public health system is where it should be. And so the question I want to ask, and any of you can jump into answering this, is what are some of the things that you have learned or seen in the US and in the different places that you've worked and you've been able to be exposed to about public health management that you would like to highlight as a difference in how we're doing it here, and maybe some of the suggestions that could be made in terms of public health management?
Well, I guess I can go first.
Yes, Dr. Emergency Services, go ahead.
So actually, I want to give Kenya some credit, because in the region, we've actually we're doing well with what we have, right? So access to testing is limited globally, and the US public health system, which we're sitting in, I'm sure the others will have some comments, including Dr. Kimori. And you wouldn't necessarily say the US has done well either, relative with what we have, So there are some other countries in the region. You look at Rwanda and maybe Uganda, who are a bit more strict with regards to some of the public health measures in terms of closures, masking, social distancing, public gatherings. And really, that's the crux of public health and affecting the spread of the disease, right? Outside of now some of the individual factors that some of that we can't control, non-communicable diseases, other health issues. With that said, what could we do better in terms of our public health system? What did this crisis teach us? And it taught us a lot. Well, one is primary healthcare. And thankfully, the government has, at least by name, made primary healthcare development or infrastructure a priority with the UHC agenda. Now, how quickly that's moving or whether that will actually land is a different question, as we all know. But having access to primary care, decentralizing people from the tertiary or whatever higher level care hospitals will really enable people to have regular care for their non-communicable diseases, their day-to-day issues that are affecting their likelihood to have worse outcomes with COVID. It will allow people to potentially access care with minor COVID symptoms or equivalent symptoms that maybe are a flu or something else. So this idea of decentralizing care, equipping primary health care, giving people access will be transformative. And I will say that to that point, access to care is truly an indicator of outcomes. The reason why people did so poorly in Italy was because it was this small town with a limited healthcare system that then got flooded with cases, these geriatric older patients who do poorly anyway. And this is why they had this insane, just catastrophe in Italy. So access to care and good quality health care services are absolutely an indicator of how health outcomes will do in terms of COVID-19 in a country. The second point is emergency care. And I am a little bit biased. However, and I wrote a piece about this actually a couple of days, which I submitted to a journal, and we'll see if it'll get published, is the idea of emergency care as the front lines, right? So when people are coming in with their in extremis with shortness of breath, can't breathe, need oxygen, where do they go? If they can access care, the emergency department. And I'd like to highlight my very close colleague and primary collaborator over the last 10 years, Dr. Benoit Shira, who's actually the only emergency medicine physician trained, consultant level trained person in the country. And Ben really does not sleep, but I talk about him whenever I can because he's doing all of the right things for Kenya, and for no other reason but just because he loves our country so deeply. And he started an organization called Emergency Medicine Kenya Foundation, who's also doing some really incredible work around all the things that we talk about with regards to emergency care. And so if we can get some more resources, funding, prioritization from the government for emergency care and understanding its importance, that would also be really excellent in terms of how we manage COVID. And other help.
Wow, very cool. Thank you. Thank you for sharing that. Anyone wants to jump into that?
I think I'll
go ahead, Dr. Ashira.
I'll just piggyback on what Dr. Christine said is, the lack of access to care, right? I think COVID for everybody, really any institution, any sector, showed that we have been focusing on some things, but the foundation of whether that's in the education system or health or access has been lacking and deficient. The access to social services, especially for these vulnerable and marginalized populations. And to really effectively tackle that, we have to have collective action, multidisciplinary action, which is a big part of why public health is successful, or really any aspect of medicine, is when we have a team's approach. And Dr. Christine mentioned we may not be doing good in this country with what we have. We have a lot, and the research shows that America spends a lot of money, but the outputs, in terms of looking at health overall, we should be better than what the numbers show. So I think Kenya is also doing a good job, but I would challenge, whether it's here or there, for really that focus on collective action, to where we understand that we cannot only give access to testing, we have to also tackle other aspects of it. And because diseases impact things other than diseases, right? It's a whole dimension of wellness. When I'm sick, the educational aspects, the emotional aspects, and we're seeing mental health cases rising. They're already there. The stigma related to that has kept that hush-hush. But so now these things are feathering out. And the only way we can effectively tackle that is comprehensive collective action, where rather than operating in silos, we operate team-based.
Wow, thank you for that. Dr. Kingori.
In addition to what Dr. Ngaruya and Dr. Ashira have said, there's one thing that we don't do very well, and that's emergency and disaster preparedness. We have not done a good amount of investment in that, I would say. Here in the United States, again, we have the resources that we need. We did have an office in the state that was disbanded by the current administration. But when we're thinking about Kenya, I think they've done well with what they have, but there's more training and education and advocacy that's needed for emergency and disaster preparedness. What we do is we wait for something to happen, and then we are caught flat-foot and we run helter-skelter trying to figure out what to do. And in that time, we waste a lot of time. And as you have seen here in the US, we have had a lot of people who have died, a lot of people who have gotten infected, but we also have people who are resisting the preventive measures that we are proposing. And so if we had put forth some sort of emergency and preparedness plan, and we would constantly remind people, if this happens, then it's good if you do this, you do that. We've done a little bit of that with vaccination and immunization, but we still have resistance. But right now we have a lot of resistance because people are scared. People don't understand what's happening. In Kenya, again, good thing, we have a lot of young people. So if they get sick, chances of them, feeling better are increased. In this country, it's a little different. In Italy, as Dr. Ngaruya highlighted. Again, we have more of the older generation who are at a predisposed risk. But I would say that emergency and disaster preparedness is so critical. And of course, investment in healthcare systems is important. It's a collective, it's a teamwork, it involves different agencies. And, again, dealing with the issues of corruption, dealing with the issue of mismanagement of funds. So all those things play a role in determining how best we are responding to these catastrophes.
Oh, wow. Thank you guys for your thoughts. I'm taking notes. I'm going to have a conversation with the Minister of Health. I'm joking.
Please do.
But it could happen.
Please do. Please do.
Please do, yes.
Could happen. I want to invite questions. So if you're watching and you've got questions for these wonderful ladies, I want to invite them. Time flies when you're having a good time, and we're already 50 minutes into our conversation. But I want to give a few minutes for questions. So if you have questions, just write them out, and we'll get to attend to as many of them as we can. I also want to say that we should do this again. I think there's a lot to discuss and have conversations about. As we wait for these questions, I want to go back to your journeys for a little bit, and because I want to end, hopefully in a space that inspires young people and especially young ladies, because they're looking at you and seeing the journey that you've gone through. So the first question I want to ask is, did you have mentors? And what did mentorship do for you? Dr. Ngaruya, your was so strong. So let's talk about your mentor.
You're so funny, Amani. So no, actually, mentorship is literally one of the hills I die on. Mentors make or break a trainee. A mentor could be the difference between someone pursuing a degree or a career and them quitting, right? And there are many cases of that. Stories of people who've told somebody, this is not the right thing for you. I don't think you should go, And so for me, and this is again where this family fund really came out of a heart space of these mentors, particularly in Nebraska, and I speak about that first, where in undergrad, coming to the US and thinking, things were all going to be, we say in the US, hunky-dory, or just like everything was going to just go really smoothly, and finding actually a big culture shock where people don't know how to say your name, don't really care about you, actually don't know how to deal with you. So instead of engaging, they sort of run the other direction. But finding these individuals who, had really nothing to get out of mentoring me, but just seeing me do well. I had an advisor in the career, in my degree advising program, who would, stay on calls with me up until 5, even 6 p.m. I remember one time her calling and saying, let's make sure your courses are done. I had a woman who's now the chair, actually, of the sociology department at UNL, where I went to undergrad, for good reason, who literally took me under her wing and said, yes, we'll do your research project, even though I don't really have time. That became my honors thesis, which is the reason I graduated with honors, and, really took me under her wing and included me on a research paper, who Dr. Washira and Dr. Kingori will understand. Took a mentee who probably didn't know exactly what she was doing, but kept my name on a research paper, which in academics, that's like your currency. And that's the same paper I still quote, cite, 10 years down the line. And she continued to be that way. I had a woman who was in our career services for the university, and she kept editing my documents well into medical school. I mean, almost like 5 to 10 years later, just because she wanted to see me do well. And I have so many stories like that. I have about 6 people who really were crux at that time. And if they weren't there, I have one more who was a dermatologist, even though I didn't want to be a dermatologist, who would just write me prescriptions for my acne, because if you don't have good skin, that affects your self-esteem. But I mean, these are people who were not mom's family, anything, who just really took you under their wing and kind of brought you to light. And so I talk a lot about this, and I could keep going on this. I'll let others chip in, but really having mentors, I cannot harp on it enough. Seek them out if you don't have them. And I think we all avail ourselves for that. So I'll let others pitch in.
Thank you. Dr. Ashtra, let's talk about your mentors.
Yes, piggybacking of what Dr. Christine has said, they can make or break you. And for me, growing up, actually, my greatest mentors are personally my parents, specifically my father, because he was a student in this country in terms of, master's all the way to PhD, and teaches at HBCU. So he understands the plight of the minority student. But also coming to this country, I came when I was 11. he was aware, cognizant of the challenges that we would face as as Black kids, as kids that speak with an accent, kids that wear a turban, for example. So he was able to be proactive, but he was able to do that because of the mentors that he had that were people of color from countries in the East as him. So the benefits of his mentorship impacted us in his parenting. And then in academia, I think it wasn't until maybe my master's really where I now directly had mentors that were not tied to me genetically in any way. And it really made a difference because I had, when I was working as a nurse, applying to grad school, one of the doctors I worked with, he was a DO MPH, which is one of the reasons I really loved the DO MPH track. He took, he noticed that I was always learning. I was always asking questions. He was a cardiovascular surgeon, so I would always ask questions. He goes, but that's beyond your spectrum as a charge nurse. I go, no, I'm interested in this because I do want to be in medicine. And once he realized that, he really took concern into how your application's coming. What are you doing? What are you thinking? Have you thought about public health even more? So before I really got into it, he helped me understand what public health was all about, and this idea that you don't have to be a doctor to really impact communities. And because of that, it helped change my mindset of that I can help people and impact my people and my country through other tracks. And because I'm a community person, community engagement is really my passion. It gave me the prescription to do that. And then in my PhD, at that point, I was really the only immigrant in student-wise. So I didn't have other students that looked like me, but I had a librarian actually, that because I used to always be there and I used to wear really cute heels. I'm a shoe fashionista. It's an addiction. I'm working over it. I'm never going to get over it. She noticed my shoes. And so that connected us. And then she asked me, you speak with an accent. Where are you from? We talked about that. And she goes, man, I really want to see you succeed. And at that point in that dissertation journey, she said, you're going to have to work hard. You're going to have to work harder. So whenever I'm working, I expect to see you. So that accountability, that somebody is watching for me and watching, not so that to see if I'll fail, but watching to watch me when I succeed, it really does something to you. I think it really does something. And so all those experiences even ignited the passion for me to mentor, whether it's my students, and really walk hand in hand to like, as Dr. Christine said, to figure out, is this the degree for you? I have students that I say, listen, it ain't it. Public health is just not it, but let's talk about it. What do you like? So we spend so many hours over coffee talking about, I like this, and doing the work to say, then you may want to go into communication, but that's public health because we need educated masses. The masses need to be educated. So I believe in mentorship, and going back to what I shared about the Youth Engagement Society, the need for that. And it's beautiful that us as women, we are not only helping here, but we're helping back home where it's needed the most. We need us to help us because we understand the story. We understand the challenges. We understand the struggle and the lived context. And I can say something, naeza sema kitu mtu ashike, that somebody else cannot. I can say something in a way that my grandmother or somebody that looks like my aunt will understand.
Tumekuelewa wazi jo. Asante sana kwa hiyo job unafanya. First, before you answer, Dr. Kingori, I want to acknowledge some comments that we have from Melody. I'm going to ask a question later, but from Dave KK, he says hi. Jane Thiomi says hi, Dr. Kingori. Nicole Njeri says well done, Dr. Kingori. Gladys says this is a great talk on health. Gladys Mungai. And thank you, Dr. Ngaria, for sharing your information on Cadusa. As you answer the question on mentoring, there is a question about a certain attitude that is here in Kenya. And this is how the question is framed. So right now, the mentality around us is, let me get corona and get over with it. What are the dangers of this mentality to them and society at large? How can we shift their perspective? As you answer that question, let me ask that you, for viewers and for you, our panelists, just for an extra 5 minutes. We've just hit the 9 o'clock mark, so maybe 5 to 10 minutes max, and then we'll close this. Is that okay? Okay. So go ahead, Dr. Kingori.
All right. So that question is really interesting. It's a big question. And I think I'll go back to what I said earlier. People are scared. We don't technically have a cure right now. And so I think this is people's coping mechanism. And so that they can stop being nervous, because the information that's coming out is, you need to protect yourself. If you don't protect yourself, you're going to get sick, you'll die. And so the mind has to find a way to take in this information. And the thing that comes out is, oh, well, I might as well get it and hopefully I survive. So people are exasperated. And I think that's the wrong attitude. What we need to think about is, how can we protect ourselves and how can we protect others? Dr. Ngaruya is an expert in non-communicable diseases, but she's also a medical doctor. And we know that COVID is passed on from one person to another. So we have to think about the other person, and so if we find ways to protect ourselves, then we won't have to worry about getting it. And some people are walking around asymptomatic, but it's not doing anything to their bodies. But that doesn't mean that we should all go out and just be merry. We've known, health behavior, people don't like being told what to do. And, we are the health police, so to speak, and people just don't like being told what to do. But I would say that we take this on as a personal responsibility for that. And to speak on the mentorship question that you had, I have had so many mentors, and it started out with, again, just like Dr. Ashira, my own family. My grandfather was a chief in Odaya, and he was always about the community, always about making sure that the community is thriving. There are so many schools and colleges named after him, and he was so gang-ho about education. From as young as I was, he used to talk about PhDs, and he would say, don't stop at the bachelor's, don't stop at the master's. Why can't you do a PhD? Ooh, are you different from those people who did a PhD? And then the other beauty was that he never treated the girl child differently. So he made sure that the boy child and the girl child advanced, and this was passed on through their own children. My father, my mom, my aunties and uncles, they do whatever else you want to do, but make sure you get an education. And so that's where I got this passion to go out and achieve. And I want to also emphasize that you cannot just be successful because you go to school. Okay, I tell people, find that thing that you're good at. Okay, and pour in all your energies in it. If you want to do carpentry, be the best carpenter. If you want to do music, be the best musician. Of course, we know that, like I said earlier, parents want us to succeed and have a good income and be comfortable, and that's always translated into money, but that's not always the case. I think we just need to find something that we're successful in. And so I've had mentors, and I've collaborated with mentors, and I still call on them to this day. And, I tell them, here's where I am, here's where I'm planning to go. What do you think? And so mentorship is really critical. And I have a whole slew of mentees as well. I like giving back, but there's a lot of things that we have. And so I want to share it. I want to see someone else be better than I am. I just received an award recently for mentorship from our university. And it was just an honor to see students, recommend me, and I got this award. And what I said is, I believe that the student should be better than the teacher. And so I'm always looking for opportunities to give back. And I have one of my mentees on here. She's the one fielding the questions from YouTube. So I mentor them any way I can, so they can see that anything is possible.
Wow, well done. And I am here now wondering about our friendship, because you haven't mentored me. I'm joking. I'm just joking. I want us to end this conversation, and it's sad that we have to end it. And you've set the tone for us, Dr. Kingori, with telling people that be the best of whatever you want to be. But before you go, before you switch off your mic, Dr. Kingori, I'm going to ask you, if you had the last word to a young person in Kenya or in Africa or in any part of the world, the last word for them to make a decision of where they wanted to go in their career, what would you tell them?
I'd tell them they matter. That decision matters. And I'd tell them that they're unique, everybody has their own different story. You can ask my dad, the three of us, even with my late brother, we all went different paths. Let it bring someone else up. Let it also make someone else's life better.
Okay. So you matter, you're unique, do what you want to do and do it very well, but do it also for the benefit of other people. Good job. Dr. Wachira.
Piggybacking of what Caroline says is, I believe purpose is when passion and talent intersect. So what makes you happy? What makes you sad? And what in society, if it's that sad thing or that angry thing, what needs to change so that you're not always sad? So that passion, is it social justice? Is it racial injustices that just really take you off? Okay, align with that and find what you can do to make sure that doesn't happen. So passion and talent go hand in hand. And when you're driven by those two, everything you do now becomes sustainable. As Dr. Carolyn said, you wake up happy because your heart is in it. Yeah, are there days where you're like, you get a denial, for example, on a publication, you're like, well, I quit, I'm done. Or that student writes a bad review, I'm done. No, you come back again for more because you cannot disconnect from that passion. It drives you. It keeps you thinking on ways to be and do better. And purpose goes a little bit beyond that. It needs to be authentic. My purpose and my passion are authentic to me and the God-given skills I have and what I like. And yours will look different. So find your own path. And don't be afraid if there's nobody doing things the way you are. You may need to be the example for you, but also for other people. So continue doing the work, be authentic, and let purpose drive you.
Wow, such a quotable quote. Purpose is where passion, the intersection between passion and talent. Mm-hmm. No pressure for you, Dr. Ngaria, but you've got to top that, eh? You've got to top that.
No pressure.
No pressure whatsoever.
So thanks again, Mani. I did want to make a slight comment on the clinical aspect regarding what Caroline said, Dr. Kingori said, and specifically just highlight to people that, unfortunately, we still don't know what the immunity to COVID confers, even if somebody gets infected. And that's really the sad case. All the studies we've done to date just show that there's mixed and probably even maybe no immunity, if any, even if you are infected. So that it doesn't work like our typical viruses. It doesn't work like our typical infections. So we have a slogan in the US, we go to work for you so you can stay home for us. So continue to practice those public health measures, social distance, avoid large gatherings, wear a mask. Please, 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 because the immunity won't necessarily come like you think it will. On a lighter note, regarding mentees and young people and what they should hopefully take away from this, I will just say that anything is possible, okay? So we sit before you and you see the success, but someone shared with me a really excellent quote that I really love about grant writing, which is again another big currency in academics. And they told me that the people with the most grants also have the most rejections. Okay, so our stories, our success stories are colored with many failures. Okay, yeah. So my quote is, it's not how you succeed, but how you get up when you fall. It's not how you succeed. How you get up when you fall. Okay, so set your sights for the sky. And the last bit is just re-echoing that idea of mentorship, because you will give up on yourselves at points in time, and you need those mentors alongside you to continue to push you along. Thank you.
I cannot thank you. Yeah.
One more thing before you finish. I think we've talked so much about, finding the value from other people, but I want to remind us that you're your biggest cheerleader. And so you need to be your own mentor as well. And you need to be there for yourself, because someone else can't bring you out of that darkness if you don't believe you need to get out of it. You know, someone else can't really force you to become anything if you don't believe you are something. And, you know, we are there to fuel as mentors, but it's you at the end of the day. Believe in yourself, have faith in yourself, and above all, love yourself.
Wow. Thank you. I just want to acknowledge two comments that have come. Ogeni Wamba, who says, such a great meeting of great minds, very inspiring. And Yvonne Kuptong, who says, great conversation, everyone. And I agree with that. Dr. Ngaria, Dr. Washira, Dr. Kingori, this has been a wonderful conversation. I couldn't have spent my Thursday evening in Diani doing anything better than such an enlightening meeting and such, you know, brilliance being displayed. And I want to say thank you for allowing your light to shine through the work that you do. God bless you. I want to do this again. And for you who was listening and was watching, thank you for staying with us. Thank you for getting in your comments and the questions. Dr. Ngaria has posted a link for the scholarship fund, the family fund that they have for the University of Nebraska-Lincoln, for anyone who's interested, so check that out. God bless you. Have a great evening, morning, afternoon, depending on where you are. And I hope to do this again with you. Bye.
Thank you.
And thank you. Thank you, Amani.
Thank you, Amani.
Thank you so much. Thank you, everybody.
Thank you very much.
Yes.
And thank you, Gloria, as well, for fielding the questions. I really appreciate that.
Oh, that is fine. It was a pleasure.
All right. Thanks so much. God bless you.
Thank you, guys.
Are we off? Thank you guys for tuning in. Be sure to subscribe and look up all those individuals that are coming. I will make sure to tag them, post their LinkedIn links on there so you can connect with them.
Thanks again, guys, for coming on.